started. So I want to thank all of you very much for joining us today. This is the first in our new series, which we are calling Executive Pathways for Leaders. And today is Navigating the Return to the Workplace. So I heard from a lot of you that have already or are thinking about returning to the workplace, meaning your employees are coming back. Most of our organizations have continued working, but you haven't had people necessarily working in the building, and that's either happening or going to happen for most of you very soon. So these require new skills, new information. Leading through these times has been interesting, to say the least, right? So we reached out to our friends at Considerat and asked them if they would provide some much needed technical assistance for those of you trying to make these tough decisions. So Considerat, if you don't know, it's a national organization that focuses on exceptional HR solutions. And today we're going to cover transitioning employees and employers back to the workplace, maintaining morale and mindfulness in a crisis, challenges ahead, and you'll get some specific do's and don'ts and tips, and we'll have time at the end for questions and answers as well. You know, all the things that we talk about at Vision Serve Alliance, they're guidelines and their advice. And this situation is different in every state and every community. So there's still a lot of individuals' decision making you're going to need to make after this. But I'm hopeful that it will give you additional information to make those decisions easier to make. So I'd like to begin by introducing our speakers today. So first we have Mike Buonaiuto. Oh boy, I blew. Oh my gosh. Buonaiuto.
Yes.
Buonaiuto, who is the Business Performance Advisor, a great guy, has presented to our Florida agencies a few times and works with a number of them. So happy to see you, Mike. Thank you. We have Amara Abedi, Project Manager, Research and Analysis, Marketing and Business Development. So welcome, Amara.
Thank you.
And we have Jessica Larson, an HR specialist. And last but not least, Nick Siska, Manager of Safety Services. So with that, I'll turn the podium over to Mike.
Thank you very much. Well, it is our absolute privilege to be communicating with all of you today. Ellie Dupre reached out to me a few weeks ago, and she asked if we could connect with your alliance and have this. She introduced me to Lee, and Lee sort of explained that she heard all of your concerns and wanted to deliver some value from subject matter experts on employer liabilities, risks, checklists, the things to be wary of to avoid the pitfalls for returning to the workplace. Because a lot of small businesses and mid-sized businesses do anticipate pitfalls coming down the pike without a precedent like this before. How do you navigate these unknown waters of returning people to the workplace in both a safe manner, a compliant manner, but also a productive and engaged manner so that your business doesn't falter in these times, because we all know it's been tough enough. So I'm going to share my screen so that we can get into this PowerPoint. So yeah, I think I'm going into the second slide right now. It looks like it's partially transitioning. Maybe one more click. Okay, so this is our agenda. We want to go over the guidelines and phases for opening up America again. Lee hit the nail on the head that we're all in different territories, so we all may be experiencing different phases, and that's all right. You may be closer to opening up, like if you're in Columbia, South Carolina, where my dad is, I know things are just very open. Or if you're down in Fort Lauderdale, where I am, not a lot of essential businesses are. We want to address the issues that you should be addressing with your teams, helping you understand what essential and non-essential employees are, and how to communicate your plans, which you should be formalizing, and how to execute them the right way. So There's considerations for having flexible schedules, government regulations that you should be wary of, that you should be cognizant of, the risks associated with returning to the workplace, being as it's such a risky season, right? Also, workers' claims considerations, what to do if someone actually has COVID. We want to go over a couple scenarios with you, speak to you about how Insperity clients have been working with us to remain resilient, and really the entrepreneurial spirit of America has been able to overcome this and find the positivity in such an opportunistic time to turn this crisis on its head and establish you guys as the need to work at places. And how do you guys retain your employees throughout all of this? And we're going to speak a little bit about culture and then takeaways and Q&A. And if you happen to have any questions throughout the course of this, please chat it, and then we could take more verbal Q&As towards the end. So I'd like to kick this off over to Nick. He is our Manager of Safety Services for the Southeast. He is overlooking all of our property and casualty. And Nick, if you don't mind, touch on how we can reopen America and what the phases currently look like for different areas.
Guidelines for opening up America again. 3 phases, each one pointing to the next. Phase 1, encouraging telework, returning in phases, minimizing non-essential travel. Phase 2, non-essential travel resumes. Continue to encourage telework and social distancing. Schools can reopen. Large venues can reopen with limitations. Phase 3, unrestricted staffing. At-risk people resume public interactions, hospital and senior living visits.
Thank you, Michael. As we look at guidelines for reopening America, they're usually in 3 different phases. So as you kind of go through each phase, some of the phases may be states haven't got to specific phases. So some states may be in phase 1, maybe not even in phase 1. As Michael was mentioning, I live in Baltimore, Maryland, so the city itself has not entered into phase 1, but the state of Maryland has almost got into phase 2 already. So just keep that in mind as we go through a lot of what we tell you today. You need to kind of be cognizant or aware of what your local jurisdictions are doing, county, statewide as well. So just so that you know kind of where you are in the phases, but most of them are kind of universal as they talk about the phases. So, phase 1 is probably where most of the states are looking to get into phase 2. So phase 1, businesses are being encouraged to have employees telework or work remotely if possible, if they're still in that phase 1 framework. Minimize non-essential travel. So you can bring back employees into the workplace in phases or, staggered, so they're not all coming back at the same time. Keep numbers of employees in the workplace down and hopefully prevent an infection. And in this phase, it's also, like I said, encourage that non-essential travel, or that is, if it is essential travel, that travel be limited to maybe kind of local travel within your kind of where you live type travel. Anything outside of the state, you may want to take a closer look at and see, is that really essential travel? With phase 2, they're still encouraging telework or working remotely to reduce the number of employees in the workplace. So again, non-essential travel can resume while still practicing some social distancing aspects. And in this phase is where you see mostly schools, large venues could potentially reopen with a lot of restrictions. I know that, and we'll probably touch on this later in this presentation, some schools have just closed for the year. I know in my state, they've done that. So, they've kind of taken that aspect out of phase 2 for a lot of the schools and large venues. And then in phase 3, this is kind of where things start to get back to normal with no limits on staff returning and resuming of public interaction. But like I said, a lot of the phases and the aspects of the phase are, based on your jurisdiction, where you live, what county you live in, what state you live in. So again, kind of being aware of where you are within your state to make sure that, you know what phase you guys are in.
Right. And I know a lot of you have social service nonprofits, right? So you probably have people visiting the office And how do you address outsiders coming in? How do you address, should you be testing people that are making meetings with you? And should you be closing your doors completely until a different lift is drafted by your local city council? So if I just jump over to this slide to the left.
Issues employers must address: training employees, screen employees, cleaning and disinfecting, maintaining social distancing, provide protective equipment, and limit business travel.
Nick, what sort of recommendations do you have for these business leaders on proper cleaning, disinfection, wearing masks, monitoring, testing, and how do you implement that in their workforce? What should they be doing to educate their workforce or train them? And what sort of checklists or ideas should they have when they're creating these policies?
Well, first of all, you need to look at least training your employees or your worksite employees to understand the symptoms of the coronavirus. That would be the first step. So, training those employees that are going to be coming into the workplace how to recognize someone that may have been exposed or has coronavirus. Some of that can be, steps you take in training your employees will be the kind of the first opportunity for them to see that it's safe to return to the workplace. And then you as a business owner have taken time to think about their safety. So the training can be as simple as just recognizing COVID symptoms, what to do when you recognize those in another employee. If you have a plan in place as an employer, you're going to need to follow specific guidelines and programs that you have in place for all employees, bringing them back. Some businesses may implement a screening process. This needs to be more of an internal business decision made by individual businesses. So that way, there may be some situations where employers may feel the need to conduct screening themselves, where they would use their own employees to perform the screening. In that case, you need to look at social distancing for the screening areas, personal protective equipment considerations for the screeners, and again, have a company policy around privacy and the next steps that should be in place if someone were to be screened and have a known case of coronavirus. So some of the CDC symptoms list continues to grow as we talk, but a lot of the main ones are, difficulty in breathing, chills, muscle pain, headache, sore throat, loss of taste or smell, feeling feverish, or a measured temperature greater than 100.4. So those are some of the things that you can train your employees to look for, or train to, recognize that in themselves. So if they feel that they're having some of those issues, inform management, let them know, hey, I have a potential issue here. And then, you can take steps from there to kind of get them tested, or they can take steps to get themselves tested. Now, if you go down the screening process and you are using an employee, just know that they could potentially be exposed to the coronavirus in the screening process. So you need to kind of make that aware, or make them aware of that during the screening process.
Well, when I see clean and disinfect, I know that a few of my colleagues, clients, they focus in these areas of what materials they will be cleaning. So high touch surfaces. If you guys have phones at the desks, you should check out the EPA website to see what types of cleaning products you should be using on what sorts of surfaces. And also think about when you're cleaning or disinfecting. All very important to get into a habit or a routine of cleaning specific things with the right products. I want to jump into how we look at what employees should be returning to work.
Return of essential and non-essential employees. Define your essential employees based on their skill set and expertise. Communicating company-wide the objective criteria for essential and non-essential employees to avoid confusion. Assess employee readiness to return to work. Soliciting feedback from employees on their readiness to return to the workplace. Or understanding and conducting an assessment if an employee refuses to return to the workplace.
And this question is for Jessica. If you could if you could guide a business owner into evaluating what employees are essential and non-essential, how would you guide them on choosing who should be returning to work, and looking at that fourth bullet point, evaluating their readiness on returning to the workplace?
Yeah, absolutely. So first and foremost, we all want to think of ourselves as essential, and nobody wants to hear from their employer that they're non-essential. However, with the three-phase approach that we talked about earlier, there's definitely a phased approach to not bringing back everybody at the same time. Your business may have slowed down during this time and not all employees were needed. So the best way to review the objective criteria you put in place for your business and how you established which roles were essential and implement that phased approach. So for example, if you bring back a number of employees to a facility, who would they be? What skills and expertise do they possess that make them essential to your organization? Then plan the communication to the whole company to explain what the skills are and how you came up with them, and the return plan and what that really looks like for your organization. And it's going to look different for everybody. But this will really help employees understand the rationale and let them know it could change over time. But across the board, communication to your team is key so that no one is left questioning why they're essential or why they were not essential.
There was a poll that was just put on the screen, and it makes me think, what would be different in the next phase? So just jot down right now, what is the next phase going to look like in my business? And then think about what Jessica just mentioned. Who would be returning back to the workplace in the next phase that isn't currently here now, and why? You should have reasons. You should have formalized reasons to follow the procedure of returning to the workplace, because that's going to help you avoid pitfalls in the future. You talked on this a little bit, and I hope you could expound on the importance of communication and formalizing a plan and executing it.
Yeah, absolutely. So throughout this presentation, I'm really going to harp on communication, and it truly is key. So you can really plan all you want, and your plan could be amazing, but if you don't effectively communicate it to your employees, I don't really know how good those plans are going to be. So as I see it, there really is two key stakeholders that you should think about when devising a communication plan. Really, it's your employees and your leadership team. And when you think about it this way, it really could help streamline how you're going to communicate it to them. So let's start with the employees. You may have had employees working remotely. You may have had employees who are placed on temporary layoffs, but when moving back into the workplace, this group definitely needs advance notice, as much as possible, but most likely a week should be sufficient to let them know that they're an essential part of your organization and that they're being asked to return to the workplace. It's important to give them ample time to work through what they may need in their personal lives to get ready to return. Now, we'd like to think that all our employees are sitting at home on the couch waiting for your call, but might not be the case. So I encourage a company-wide conference call or a Zoom meeting like we're in right now regarding the return to work process, and get everybody on the same page. Share any new or updated or otherwise relevant policies and procedure. It's important to reinforce that the policies that were put in place before COVID continue to stay in place. I think there's a lot of folks wondering what will change and what's going to stay the same. So the more you can fill in those gaps for employees before they return, the better the company will be, and employees won't be filling in those gaps themselves. So as I mentioned before, be sure to share what protocols you put in place around sanitation, cleaning, and make it a safe work environment. I think it's on the top of everybody's mind right now, and it's important to tell them in the call that everyone has, if anyone has any specific issues they want to discuss and regarding their personal circumstances, they can connect with you individually. So it's important to keep that open door policy during this time as well, even though you might not be physically in the workplace, but reiterate they can call you with any questions.
Right.
Yeah. So, part of the second part is your leadership team. So for your supervisors and managers in your workforce that lead your organization, it's important not to overlook this group because they're the front line with your employees day to day. They're the ones answering questions and reinforcing the policies. So I encourage a separate meeting just for your leadership team to make sure they're comfortable with the protocols and policies and that you're answering all their questions. I would suggest spend some time dedicated to two-way communication training. I know if any of you are Insperity clients, we have great communication resources through our Insperity training portal. But even if you're not an Insperity client, spending time in this area, because when they're interacting with your employees, it's important to boost morale during this time, and a little training could go a long way.
Yeah, so this is really what you need to do. If you haven't spoken with your employees in the past 48 hours, if there isn't someone that you haven't communicated with, you really need to put yourself out there and reach out to them. And I don't know if you have or haven't, and I don't know if you have 5 employees or 500, but there is so much importance on investing in your human capital right now in terms of the trust and relationship. So make sure that if not yourself, another person in command has reached out to every single one of the employees, and it should be as frequently as possible, right? We used to be in the same office together. We used to be able to see each other and go around the water cooler, but you need to go above and beyond in this time. Now, there are going to be employees when we're returning back to workplace that don't have daycare, that don't have schools. I mean, we're getting into the summer, it's probably difficult for a lot of your employees that are parents to handle juggling both things. I know I have 2 colleagues that both have 3 children, and they are really working hard. So Jess, can you speak to the things that employers can do to help adjust for these shifts in work schedules for their employees, and what sort of things they should know that their employees have rights to?
Key considerations: school closures and the employees needing to return to the workplace. Consider flexible schedule planning and federal and state regulations, including emergency family leave and emergency paid sick leave.
Absolutely. So first thing to consider, can your organization provide flexible work schedules? I know a lot of companies are doing it right now, and I suggest, continue to do so. Maybe taking it a step further and really thinking outside the box regarding those schedules, such as providing night schedules or off-hour shifts, can really help accommodate these employees who, may not have access to childcare, or because schools are closed, and depending on the state you're in, which phase your state is in. But I also want to mention there's a lot of local and state and federal law requirements intended to protect the employees regarding COVID-19. So for example, the Family First Coronavirus Act is a federal law that provides emergency family leave specifically to take care of children due to schools being closed. And it also includes job protection during this time, as well as the emergency paid sick leave provided through the law. Just a reminder too that the FFCRA is in effect until the end of the year. So as states begin to open up and we move through those phases, this is not going away. It's in effect until December 31st.
Potential risks of returning to the workplace: managing expectations and regulations of wearing masks while in the workplace, bringing back employees who have tested positive for COVID-19, testing for COVID-19 as a hiring practice, and creating and adjusting policies and procedures, telecommuting, and business traveling.
When we do return to the workplace, you are definitely going to have procedures in place to keep it safe, because as an employer, your biggest asset is your people, but also your biggest liability is your people. And that's frankly what we're all concerned about, is on the horizon, are there liabilities looming that are going to surface from exposure of having an employee that has an intimate partner that has COVID, or someone refusing to wear a mask while everyone else does. What does it look like in different public spaces in the office? All of these things are running through the minds of your employees as well as yourself, right? You've probably thought of very similar concerns, which is good because you should be providing the vision for your company on how to adapt and mitigate these risks. Nick, can you speak to the risks that these employers should be cognizant of, and what sort of rights or responsibilities they have knowing that maybe someone has tested positive, or they know someone, or their willingness or unwillingness to wear PPE? If you could just touch on that, that would be great.
Sure. So there's really no safety standards for COVID-19. So OSHA, which is the Occupational Safety and Health Administration, they have some standards related to reporting and submitting your 300A as it relates to COVID-19, but there's nothing where they've mandated where you have to wear a mask. And usually the wearing of the mask is usually a business decision. So if you as a business want to require employees to wear a mask, it would fall back to the OSHA standard that an employer needs to provide a safe and healthy workplace free from recognized hazards. So within that, if you kind of get into the weeds a little bit, I guess you could say you're preventing a hazard or a recognized hazard by having your employees wear a mask. So the second part of that, or part B of that same standard, reads that employees, I guess to paraphrase here, employees need to follow or abide by any rules put in place by the employer to protect themselves from recognized hazards. So as you, as an employer, know that you may have a potential recognized hazard, COVID-19, you want to require employees to wear a mask, that's fine. Employees are required to wear that mask. So there should be some kind of program or plan, safety program or plan in place that outlines the wearing of the mask, why they need to wear it, how to properly wear it, and then training for those employees should also be done as well. So that way the employer is kind of covering themselves and the employee gets training and knows why they need to be wearing the mask. Face coverings, and these are guidelines by the CDC, have come back and said that cloth masks are fine. You don't need the respirators with the HEPA filters. That's probably an overkill, but something that protects others. So a mask that you wear is not for your protection. It's for the person sitting next to you that maybe you can't social distance by 6 feet. It's going to protect them from any type of spray that comes out of your mouth.
Yeah, and if you don't have a box of masks at the office already, if you can't find them, reach out to me. I have a lot of places here in Fort Lauderdale that I could order some from and ship them over to you. But you need to be prepared, and you have to have those materials at the ready for if someone shows up to the office without one. You don't want to turn them away and send them back home, especially if it's on their schedule to show up. So be prepared in that instance. There is liability for workers' comp. Nick, if you could touch on how you would, just handle a COVID-19 incident if one of your employees tests positive.
Sure. So is the coronavirus compensable under workers' compensation? That's a lot of the questions that are being, I guess, pressed to me and some of my consultants. So currently all states have some form of workers' comp coverage for occupational disease. That was before COVID-19. That's going to be after COVID-19. So while compensation laws and regulations and case law may vary from state to state, generally for a disease such as COVID-19 to be compensable, the statutes require that it arise out of and in the course of the employment, be proven that it was a result of a workplace exposure. So the employee contracted it at work, and then due to employment that places that employee at a substantially greater risk of possibly contracting the COVID-19. virus, sorry, blank there for a second. So an example of a greater risk would maybe be a healthcare provider caring for patients diagnosed with COVID-19. So they would have a more, I guess you could say, easier time getting their claim paid, if you want to kind of look at it that way. To kind of look at it from, if you potentially have COVID-19, you think that you've contracted it in the workplace, it's going to need to be proven that it was one contracted in the workplace. There'll be a thorough investigation by whatever work comp carrier and that adjuster that works for that carrier or for your carrier. They're going to need to kind of go through the whole investigation process to determine compensability.
Right.
So if you,
I'm sorry, go ahead, Nick.
I was going to say, if you have a claim or have somebody that thinks they've been exposed to, you know, COVID-19 at work, the best recommendation I can give is to report that claim to your work comp carrier. Have them get tested to confirm that they have the virus and actually report the claim to the carrier. That way you can kind of start the investigation and get the ball rolling on if they need to be out of work for an extended period of time.
And if I could just jump in a minute, I just want to remind the participants that we are going to have a Q&A at the end. So if you just make note of your questions as we go through, or you can even pop them in chat if you want, but just keep track of them. And after the presentation, we'll open it up for Q&A. Thanks.
Yeah, for sure. Let your burning questions, just fire them off in chat and we'll address them in the Q&A. There was one bullet point that I skipped over on this last one that I just wanted to touch base, and that's testing for COVID-19 as a hiring practice. Jess, would you be able to, because I skipped over it, but would you be able to address if the employers have the right to test?
Absolutely.
Thanks.
Yeah. So if you're in the process of hiring and want to test for COVID, it needs to be done after you made that conditional offer to the employee, not before. That's the key. And if the new hire, let's say they do test positive, you can either delay their start, or if you're hard pressed and that's not an option, you can rescind the offer, but you need to have a business reason to do so. So kind of to tack on to that, I've received a lot of questions about, you know, taking the temperatures at work. And I know, you know, Nick has already kind of touched on this as well. But if you're looking to implement this practice, be sure that it's done outside your organization, again, social distance, and that you're not storing the employee's personal protected medical information, and make sure that it's done consistently. And, you know, that's going to really reduce the liability there. So with both practices, in the hiring and taking the temperatures, consistency is key.
Right.
Thank you, Jessica. That was a great answer. I see that when we discuss adjusting policies and procedures. I have a great question from Christy. She's wondering if we would consider volunteers any different than employees when we create our procedures around these practices, or should we have our volunteers sign a release form maybe? What do you think about that?
So like I mentioned before, consistency is key. So absolutely, if your volunteers are coming onto your site's organization, you can put protocols in place to, you know, reduce the risks and reduce the liability on the company's behalf. So yes.
Yeah, consistency is key. You can't treat anyone differently, and it's a good question. Just jump over to two more. I wanted to bring up just situations to hit some points home, that if someone were to call in sick and say that they have flu-like symptoms, what would you do as the employer? So Jess, would you be able to run over how you would guide any of the people on this call into addressing if one of their employees were to call with a potential COVID sickness?
Sure. Yep. So, you know, the employee really needs to stay home and recover before the employee comes back and returns to work. They need to have a call with that employee to discuss what that looks like and ask that employee the CDC recommended questions. So those questions are, you know, has the fever, if the employee has a fever, has it been gone for at least 72 hours without taking, you know, fever reducing medication? and all symptoms have improved. And it's been at least 10 days since the symptoms first appeared. So those are what the CDC recommends, and we suggest, your company following those same recommendations.
Right. And let's say someone is working in your shipping and receiving department, and their child or their partner took off time to stay with their child in home care because their child has COVID-19. So how would you instruct an employee who is closely related to someone that has COVID-19?
Yep. So the employer may follow the CDC guidance in recommending that the individual who has been exposed but potentially could be asymptomatic remain at home for a period for 14 days after the last exposure under the defined circumstances. So that is including an individual as a household member of a symptomatic person with COVID-19. So all the circumstances defined by the CDC are the individual has close contact, so less than 15 feet for a prolonged period of time with a symptomatic person with COVID. The individual is a household member of a symptomatic person, or their intimate partner of a symptomatic person with COVID, or the individual provides care to a household without using the recommended infectious control precautions to a symptomatic person with COVID.
Right. And all of this gets fleshed out in these conversations that you're having with your employees. Hopefully no one would feel stigmatized to raise their hand and say, someone close to me has, been diagnosed positively, because they don't want to put themselves at risk, because maybe they're unsure of their future with your company if they say that either they themselves or someone they're close to has COVID. So it's so important to just hit back on the communication key, that the more you communicate with your teams and the more that they're engaged with you, the more likely you'll flesh out any potential threats that they could be bringing into your workplace. There's one more scenario to run through. Let me just hang up on some of the So if someone takes off time for COVID and they go over their quarantine time, but they're just not feeling 100%, what could you as the employer do to require them to come back to work, and can you give them disciplinary action?
Yes. So yes, employers can require employees to return to work. However, this type of issue needs to be dealt on a case-by-case basis. There may be certain situations in which the employee is protected. So Sally should engage in the interactive process, have a conversation with the employee, and talk about what options are available for her to return to work. So the employer, again, still should follow those CDC guidelines. Like I mentioned before, 72 hours have passed with the fever reducing, improved respiratory symptoms, and at least 10 days. So, in short, yes, but it would behoove you to do a deeper dive into the employee situation just to make sure nothing else is at play.
Right.
I like that. If I can add a little bit to that, Michael. Jessica, that's a great point. And I think in addition to that, I would say sometimes we just have to probe and dig deeper. If the concern your employee has is about their safety, then you want to reassure them that you have taken all the right measures so they can feel safe enough to come back. Or if they have children at home and they don't want to leave them, or they don't have childcare options. So really dig deeper and try to understand what is the exact situation. Maybe they don't have enough technology, or they're whatever the problem is, try to find the root cause first, and then obviously take that disciplinary action or the right measure if you need to.
That's awesome. Yeah. There is a huge burden on everyone on this call, all the business owners, to remain resilient and keep business going. As the backbone of this great country, And as such, a philanthropic and community-driven group of people in the audience right now, like, so much depends on you guys remaining resilient and maintaining what's going on inside your workplace, taking this as an opportunity to create something positive, right? We've had the pendulum swing in one direction, and we're all very eager to return to normalcy. And it's incumbent upon everyone here to take a keen look at their existing culture and understand, how are we going to grow and thrive and improve our culture, whether it's through the lunches that you're buying for your employees throughout this time that aren't in the workplace, or the above and beyond communication that you've done to make sure everyone feels as engaged as possible to remain as productive as possible. Every one of your employees is going to remember how you've acted through this time, and we see this as a great time for employee retention and engagement. We're positive that the employees that you have through this crisis, that once we get out of this crisis, will be core and key employees, because they'll, you get closer to someone when you go through something traumatic or some crisis. The same is true with the relationships with your staff members.
Culture pre and post COVID-19. Reevaluating your workplace culture. Back to the basics. Review your existing mission, vision, and core values and readjust if needed. Reflect on your reputation. Impressions have lasting effects. How were furloughs or reductions carried out, if applicable? Employee morale and trust in leadership.
So, Jessica, when you're working with business owners to look at their mission and vision and core values, where do you direct them, and what sort of examples could you share of getting your culture inculcated in the workplace, and also show it as a part of your reputation outwards?
Absolutely. So if you haven't taken a look at your mission, vision, and core values in a while, I suggest taking a look at it and just make sure that your organization has lived up to its standards through this pandemic. And if you haven't, maybe, see what you can do now to kind of rebuild your mission, vision, and core values. If you ask any one of your employees what your mission or your vision is, they should be able to reiterate it to you. And if they don't, maybe it's time to revamp it and do a whole new rollout. This can also help build, culture and morale within your organization. Insperity lives by our mission, vision, and core values on a daily basis. It's integrated into everything. It's in the signature of our emails. It's in posters on our walls in our office, and our CEO reiterates it almost in every single company-wide meeting. So it really is important. So implementing some of those into your organization could really speak volumes. Like Mike said, kind of with camaraderie, and the employees that have gone through this have probably built stronger relationships, and your organization is probably better for it.
Right. So if you could lean into your culture, if you could, purchase a little piece of swag, like a charging box for a phone with your logo on it. And don't do that if you just did it, right? But find a way to just keep your employees, to keep your mission and vision front place in front of their employees, to remind them they have value. And not only do they have value, but of course, you guys, those nonprofits serving the communities with the visually impaired, such an imperative and pivotal nonprofit, just a pivotal sort of, nonprofit in different communities. Like, remind them of how much impact you guys are doing in your communities. Remind them of the clients that you're helping. And it may seem obvious, but sometimes it's not. And sometimes, the excitement comes from the top, from the leadership. And whether you're one of those leaders that leads from behind, or you're in the front going rah, rah, you really can step up and just reshare the vision of your nonprofit with your people as frequently as you can and as genuinely as you can, with the excitement that would help spark the fires within them to keep them engaged. Now, that's going to speak to employee happiness. That will trickle over into water cooler talk and minimalize disgruntled employee feelings. You'll be surprised how much is burdened on your shoulders. And maybe you wouldn't be surprised. Maybe you feel that every time you go to sleep. But if you don't, you'll realize that this culture is going to be the most pivotal thing, as well as the formalization of policies and procedures for returning to the workplace, to shape and rebuild what's going on. Jess, do you want to touch on maybe a couple ideas on how you could potentially rebuild your workplace culture?
Sure. So the first one that comes to mind is, soliciting ideas and feedbacks from your employees for changes they want to implement or see get adopted, and, implement the good ones. When employees feel like their voices is heard, again, speaks volume for your leadership team. The next one, if you had to make reductions in your workplace, or refine and maximize your available people and resources by cross-training and collaboration. When employees get trained on something new, if they've been doing the same job day in, day out for years, learning a new skill, is really helpful as well. And, that kind of helps, build their confidence, and ultimately it'll help your organization. If you have employees who are cross-trained in different positions, if someone goes out sick, someone else can jump right in. Lastly, remember to lead your people with empathy. Be a good listener and seek to understand before making any changes. Really goes a long way. And with the new normal, meeting as a team, it may look a little bit different. Finding ways to think outside the box to engage your employees will also go a long way. Some ideas, Michael mentioned, ordering lunch for your employees. Everyone needs to eat. So, if it's coming from your employer, that's just another plus. If you don't offer an employee assistance program, maybe look into one. So offering your employees, mental health counseling or financial planning, or, child care assistance through an EAP program, can really help during this time. And if you have an EAP program, this might be a great time to send an email blast out to all your employees to, remind them about it. EAP is definitely in this, the climate and that our company or our country's in right now, can go a long way if they have those resources available to them.
Right. And the employee assistance program, which you could, Google to find one that fits your needs, they could help them find childcare services, nursing home services. You could reach out to a friend that you may have that does financial counseling and have them host a Zoom and keep your employees feel keep investing in your employees in that capacity. And whatever way you could think creatively or outside the box to keep your employees engaged will just further minimize in the future any potential disgruntled employees. They'll remember that you are good people and that you care for them. And just recall that they are your biggest assets, your biggest liabilities, and you should be thinking, how am I going to return to the workplace, return to normalcy, and how am I going to advance from phase 1 to 2 or 2 to 3, and what's going to be different? How could I get my staff excited to get to phase 3? Like, should I have banners and balloons when we're all back in the workplace? It sounds fun. I think I'm going to do that for my team. I digress. There is so much compliance out there when it comes to the CDC, the EPA, the DOL, this alphabet soup of things that you need to be cognizant of. So take deep breaths, reach out to, if you have any business lawyer friends, if you have an HR team, you can always lean on those that are close to you. and keep that communication open. That is so key and pivotal to write down and formalize your procedures and execute them. Keep it consistent. Whatever you're doing, you need to have consistency so that you're not treating anyone differently, and understand exactly the steps that will be taken to return essential and non-essential employees to the workplace. I already touched on bullet point number 4. Think about flexible scheduling if you haven't already. Take a look at your floor plan. If you guys, obviously there's a lot of different businesses here, so depending on how you're set up, if you have cubicles like where we are, we've taken a look at our floor plan and we say that all of the caddy corner cubicles are able to come in on these certain days, or just go behind closed doors, or this is sort of something that will help maintain that safe workplace feeling. You could also come in early, because I'm sure that's what you want to do. Reward yourself with a Dunkin' if you do that. So get yourself a Dunkin', go in early, and open up all the doors and turn on all the lights so that no one has to touch a door handle and no one needs to flick on a switch. And, oh, my battery's running low. So that will help. All of these little things speak to the culture that's inside of your workplace. And lastly, you get to kind of rebuild, right? We've all been burnt by Corona, whether it's a hit to our revenue, our client engagement, one form or another, we've been impacted. No duh, Mike, I get that. But what are we gonna do to rebuild from the ashes? How are we going to rebuild our home? What is our floor plan gonna look like? What does the roadmap look like? And lean on your leadership team, your managers, to help you through this process.
Resources available by Insperity. Visit www.insperity.com/COVID-19. View weekly Insperity COVID-19 webinars, COVID-19 blogs, legislative summaries including Family First Act and CARES Act, business continuity planning, and crisis management.
There are resources which will circulate. I believe I've shared it with your Alliance team, but we will definitely reshare it. Make sure that you have access to the EPA, DOL, CDC, also access to our webinars. We've been doing leadership conversations, armchair conversations with other leaders in the community, and they may be very compelling to you. So definitely click through to that. And I'm going to just say this is the Q&A portion, so I will stop sharing. And
so Michael, we've been receiving great questions on the side. One that I would like to ask Jessica, if you could please tell us, in a situation where we have an employee who cannot really perform their job remotely, and maybe they don't have childcare options, or they want to take care of a family member who is sick, what do their options look like if they're unable to return to workplace if they're in a situation like that?
Sure. So I guess it's a kind of a two-part question, so I'm going to address it in that way. So the first part you mentioned was they're unable to perform their job remotely. So in that case, the employer, you might look to put the employee on a temporary layoff for an extended period of time until they're able to safely return. The second was kind of the child care. So we touched on this a little bit with the Family First Coronavirus Act. The portion where, it allows for employees to stay home to care for a child when childcare may not be available or schools aren't available. That's 12 weeks of 2/3 their pay. So, if they've exhausted the FFCRA, talk to your employees, engage in that conversation, determine how long they need to find sufficient childcare. Employer, at this point, you're no longer required to pay the employee a wage replacement benefit if they've already exhausted all their time. And then we mentioned before, if you have an EAP program, look into that. Most EAP programs do have options for helping with childcare. And what was the last part of the question? I think.
That how do they, if they're unable to work remotely, then what do their options look like? One is for childcare, but the second one, what if they have a family member that is in a critical condition or ill due to the sickness? Does the emergency family leave provide them any options?
Yeah, so let's say you have an employee, in one of the scenarios below that we talked about was, they had a kid at home or a family member at home who is sick. Under the FFCRA, employers under 500 can provide 80 hours of emergency paid sick leave to your employees. And that is either 100% their wages or 2/3% of their wages, depending on the reason. So to care for a family member is 2/3 their wages for 80 hours. So anything above and beyond that 80 hours, as I mentioned, no longer required to pay them, but try and work with the employee. Again, communication is key. Taking that deeper dive, seek to understand really what's going on in that family or in that employee's situation to see if there is an accommodation you're able to make, whether it's if there is some work from home work that can be done, even if it's part-time, helping that employee out, just trying to accommodate. But if essentially there's nothing for them to do and they're unable to return to work, they can be placed on a temporary layoff or a personal leave of absence.
I really liked Nancy's suggestion too, that, and we spoke to it earlier, cross-team collaboration or cross-team training, that if you have an employee who is able to switch jobs or roles with the employee that is unable to work remotely, maybe that could be another option that you can look into.
Absolutely.
I have a question concerning return to work with requests of employees to do daily self-tests of temperature before they might come into work. Is there any optimal policy or procedure, more so, that can be used to verify that employees are actually doing this? We've gone round and round and round with lots of different options and haven't landed on anything that seems to work real well yet.
I'll take that one, I guess. The screening of employees is, well, let me back up. There's some vendors that you can actually look at, some nurse type, healthcare type operations will actually do some screening for you for a fee, obviously, and they are able to have the full kit of PPE. You don't have to worry about employees' personal information getting stored in some manner or some way. But we have some clients that are doing some type of screening where they have individual employees doing the screening process, as I mentioned earlier in the presentation. If you go down that route, a full PPE kit, which is face shield, mask, eye protection, gloves, probably even a gown as well. So you're looking at kind of opening up the checkbook a little bit to buy all that PPE. So the other caveat of that is, Jessica mentioned it, is the storing of the employee's personal and medical information. You may open yourself up to some issues with a HIPAA violation or something like that if some of that information gets out and someone sees someone's temperatures or something like that. I know that I've seen some instances in the screening process where they're tracking and it's a simple yes or no if they're over a particular threshold for the temperature. They're not actually putting the number in. So it's one way to look at it in a tracking way. So you can just simply check a yes, no box that they're okay that day. But, again, it's kind of a gray area, and, just want to be careful of the medical data that you're collecting or storing, because you don't want to get yourself in trouble there.
Thanks.
Did that answer your question, John? I think that question is the most in the front of the minds of everybody on this call, how to handle that in particular.
It is no problem, a real dilemma.
Yeah, and I have clients now that use a third party because we've gone back and forth, and it's just not a true answer that they're comfortable with, and they don't want to get themselves in trouble with that HIPAA issues or something like that. So, I mean, the vendor route's a good thing, but then you're going to have to pay some extra money to do that. Now, if you're doing the employee screening, you're probably have to pay some money on the PPE. So you probably have to weigh both those options and what makes the best bet for you guys.
Just want to say that we were scheduled to go till 4. I know some of you need to leave, but Insperity team has said that they'll stay on for at least a little bit longer to take some more questions if you have. Wow, it's a quiet group today.
Well, a question that came up the other day in a meeting we had was about liability waivers for known crises like this pandemic. Do they have any merit in actually waiving liability for an employer, or where does that stand with waivers?
That's a great question. I think it needs a little bit more in-depth understanding. So I would ask Michael to follow up offline on that one, just because our primary service is more towards full-time employees as well as part-timers, but not so much on 1099 or volunteers. But I'm more than happy to follow up on that question, just finding the right information and sending it your way if that works.
Okay.
That'd be great. Yeah.
Yeah.
So there's a couple more questions in the chat that followed up from your question, John. So Lisa's asking, as employers, we can actually ask the employee to take their temperature each day before coming into work. I mean, you can ask them, but like you said, John, how do you know they're doing that or giving you the accurate results? And then
yeah, and I have clients that do that as well. So they rely on their employees to take that temperature, their own temperature. There's a online module that they're using to where everybody just, it's like a Google share drive almost, and they're just putting in their temperature for each day before they come into work. Now, again, that lends itself to, trusting your employee to the point where they're not going to put a lower temperature than what they're actually grading at. So there's some, human error in there, I guess you could say, but that's something that you can do to kind of keep track, or a way to track employee temperatures as well.
If it's within your capacity, like your pocketbook, as well as your risk tolerance, to have a nurse practitioner come in and handle this for you, if it's within your capacity to do so, then you should definitely get that liability off your plate. But you're paying for it, right? And it comes down to the risk tolerance. So if you're willing to have that liability of storing employee information, potentially, you should do that. And if you're also willing to have that risk tolerance, as well as trust with the employees, that what they're saying in this potentially Google form or a shared document, that they took their temperature, they're below the 100.4, you should do that, right? It all depends on what your risk tolerance is, as well as you have, I mentioned the pocketbook before, because obviously it costs money to bring a vendor in, but you get that off your plate. So that's the trade-off. And that's, if you're able to do so, if that's what you value, if you completely trust your employees, I come into businesses that are almost family run. Nobody's related, but everybody's so close. And there would be no doubt that everybody would put their actual temperature on the form. It's a no-brainer, and that's what they've done. And then there's some groups that a lot of new hires, not a lot of relationships have been built yet, are leaning more towards the nurse practitioner route. So not a silver bullet answer, but it really resonates on the tolerance you have for employer-related risks that, and can you afford having a nurse practitioner?
Yeah, thank you. Any other questions?
Lee, I have a question.
Mm-hmm. Thank you.
So you mentioned taking temperatures and doing the threshold, which I like, because I think there's a fine line of just how much information an employee wants to disclose. But how do you, obviously you share what the threshold might be with your entire staff, but how do you address concerns? Say we issue the threshold at 100.1 or something like that, and someone tests, yes, but maybe, or 99, whatever it might be. The temperature scale that a lot of people go on is 100.3. So say it's not there yet. Do you feel that you need to disclose information? Because I could see some staff members, if someone was a yes above that threshold, but not enough that they felt that they needed to disclose that to other staff members. How do you handle that? Did that make sense?
Yeah, so I guess what you're saying is they are just testing just below the threshold, and they may say I'm a no, but they're pretty close to the threshold. Am I on the right track there?
Right. Or if someone's fever, say the threshold's 100.3 and they're at 100.3, and you say yes, and an employee's concerned that what if their fever is very high and they're not disclosing that? I guess, how do you let everyone know that that's a safe number, I guess?
Yeah, well, the CDC's guideline is 100.4. So I mean, I've seen where we do the yes no check, the threshold is 100.4. So again, you need to be trusting some employees that they're going to be putting down the correct numbers and making sure they're tracking correctly. So, I mean, I would say that there's some trust that has to go both ways there as an employer and as an employee to make sure that, one, they are putting down the right yes, no answer and the right temperature for themselves, because ultimately it's them that would expose all the employees in the workplace if they're going to be saying no, they're not that threshold. So I think there needs to be a conversation had with all your employees, and if you're going to go down the screening route, a training of some sort, and explaining in very, very detailed explanations on why we're doing this contact tracing and the reasons for it, the exposures for it, and the reason why they shouldn't be lying on their temperatures. Because you don't want to get into a situation where someone has said, no, I didn't test high. Now they come in and they're a little bit higher than what they thought, and that fever may have increased as they're at work now, and now they've exposed everybody. It's kind of a grayish area, screening and testing as a whole. So I hope I'm answering it a little bit for you.
So I have an example. I have ventured out. My gym recently opened, and everybody has to stand outside 6 feet apart before being entered 5 minutes before the class. One of the staff members is standing outside and taking temperatures with the non-contact thermometer. She has her face mask and a shield on. And there's a sign with the questions, and you have to answer that no, you're not exhibiting symptoms, no, you have not been in contact, and no, you have not traveled. So I think it's very effective, as you can probably imagine. For a group fitness class, only 25% capacity, but I think they've really done a great job of organizing it and structuring it in a way that is efficient. So markers on the ground, 6 feet apart. So if you have employees that come in at 8 o'clock, just have a dedicated person, waiting for employees to come. And as they come, make sure they're staggering, let employees know not to congregate. So if you see somebody already at the door, just wait in your car or wait 6 feet apart before coming in the building. From personal experience, it's gone very smoothly. So that's just another option that you might be able to implement into your organization.
And I think some of our organizations are doing exactly following that exact protocol. Some of our organizations have been open on premises throughout this because they manufacture PPE. Their employees are essential workers. In addition to the rehab they provide these industries. And many of them I spoke to are doing exactly that. But I still wonder what happens when somebody doesn't want to, and yeah.
Well, if you have rules put in place, right, and if somebody doesn't want to, you're able to say you did not follow the guidelines that we put into place, and you are making a safe environment for your staff. And when one of your staff doesn't follow those guidelines, that's where you need to hold them accountable.
Yeah, yeah. No, I get that.
Right.
And maybe it's never happened. Maybe everybody's played nice, but I just want to say I am so grateful not to no longer be the CEO at Lighthouse Central Florida and Lighthouse Works, where you all are having to make these kinds of decisions. Yikes. So we are at 4:10. Do you have any other questions that you'd like to ask this team before we conclude?
Lee, can I ask one more question?
Yes, you can, Brooke.
Okay. My question is, if you have someone that, a staff member that comes down that is symptomatic and self-quarantines, is there some guidelines of if another staff member feels that they want to quarantine or work from home for a certain amount of time, if they've come in contact, even if they haven't tested positive, or maybe they're just showing small signs or something, but they say, I feel like I'm coming down, I want to work from home, and then it kind of trickles down? Is it a case-by-case basis per staff member?
Yes, exactly. Every single situation, case by case. And again, during this time, if you're able to accommodate and have employees work from home, I urge you to do so. That has always been my recommendation. As things start to get back to normal, we can start minimizing it, but also setting expectations up front also helps. So employees, don't take advantage of the system, so to speak.
Great.
Does that answer your question, Brooks?
Yes, it did. Thank you.
Okay. Mm-hmm.
Okay, well, I would encourage you to stay in touch with us. If you have additional questions you want to ask us later, you can do that. We will get it in touch with our Insperity team, and we appreciate you all participating. I want to thank Mike and Jessica and Amra. Is she still there? Maybe she had to go. And Nick for sharing with us and providing this information. I hope you felt it was informational and helpful. There's lots of things that you need to know these days, and this is not the last word, but it's additional information to help guide you through this incredible maze of decisions you all are making right now. So thank you very much.
Thank you, everybody.
Thank you, guys. Again,
Thanks, Lee.
on the
Thank you,
Google
everyone.
Drive, you can access any of the resources from today. We'll have the recording up there shortly. Or you can send us an email at info@visionservalliance.org. We'll get all your questions answered. Thanks, guys.
Thanks. Bye-bye.